August 29, 2019, Tampa, Florida. Federal agents walked into a small neighborhood pharmacy. They weren't there for a cartel. They weren't there for a violent criminal. They were there for a pharmacist, a man in his 70s, a pharmacist who was also a dentist, a man whose only crime was filling the prescriptions that other pharmacies were too afraid to touch. This is the story of how the government destroyed a black-owned pharmacy and why, even after fighting all the way to the Supreme Court, its owner was never allowed to be made whole. I am Dr. Harvey Jenkins, MD, PhD, retired orthopedic spine surgeon, pain management physician, and biochemist. And this is Railroaded, the story of Dr. Norman Clement. Norman Clement was not what you picture when you hear the word raid. He held 2 professional degrees, a registered pharmacist and a doctor of dental surgery. He came up out of Detroit, and he spent his life as an owner-operator, an independent community pharmacist, the kind that used to sit on every other corner in America before the chains swallowed them whole. His pharmacy, Pronto, did something most pharmacies won't. It compounded. It made medications on site, tailored to patients whose bodies couldn't handle the mass-produced version. For a person in serious chronic pain, that pharmacist can be the difference between a life and a bed. He filled legitimate prescriptions, written by other people's doctors, for patients that sometimes other pharmacies had already turned away. That's who they came for. It started quietly. May 2017, a referral, an inspection. Investigators showed up. His family asked them to leave. They left. September 2017, a subpoena for his records. And then for almost 2 years, nothing, until August 2019. First, the DEA froze his license with the stroke of a pen, calling his pharmacy an imminent danger. 6 days later, they raided it. They carried out his records, his backups, and by Clement's account, they destroyed the store's own security camera system on the way in. The one thing that could have shown you exactly what happened that day. Here is what the government's case was built on, and what it was not. It was built on pill counts, on language, on the imprecise vocabulary of red flags and pill mills. It was not built on medicine. The investigator interviewed no prescribing physicians, no patients. The government's own expert reviewed no patient charts, no imaging, examined no one. Not a single patient was shown to be harmed. Not a single prescription was shown to be fake. They accused a compounding pharmacist of manufacturing narcotics, as if a storefront in Tampa were refining opium into oxycodone. So Norman Clement fought back, alone, pro se, representing himself when the money for lawyers ran out, and he brought receipts. Using the DEA's own data system, he pulled the numbers for the pharmacies within 6 miles of his own. His pharmacy, over 6 years, moved about 348,000 units of Schedule II medication. Sounds excessive. Well, 2 other pharmacies within the same 6 miles moved 13.8 million, and more than 26 million. They kept operating. He was the one they shut down. He was the one who was black-owned and independent, and Pronto was not alone. Across the country, independent and minority-owned pharmacies were falling the same way. In West Virginia, a Nigerian-American pharmacist named Martin Njoku, 30 years serving his town, was shut down. An investigative journalist, Angela Green, has now documented dozens of these cases in a book called Legalized Extortion. Fewer than 5% of America's physicians are black. Hundreds are pushed out of practice every year, and Clement gave the pattern a name. So what did fighting back cost him? Everything. In 2021, the DEA revoked his license for good. In 2022, the appeals court upheld it. He petitioned the Supreme Court by himself and did not get the relief he sought. The pharmacy he built is gone. The license is gone. The years are gone. And here's the part that should keep you up at night. No agent was ever disciplined for interviewing 0 doctors. No one answered for the lost records. When the government gets it wrong in a case like this, there is no consequence, no symmetry, no accountability. Even if he had won, he could not have won. You cannot unraid a pharmacy. You cannot refund a decade. For people like Norman Clement, true vindication is not on the menu. The process itself is the punishment. This is not a story about one man. It is a story about who is easy to raid. Cartels shoot back. Doctors and pharmacists don't. They keep careful records, answer every subpoena, and believe that doing everything right will protect them. It doesn't. And when the target is black-owned and independent, the pattern stops looking like an accident. This does not get fixed with outrage. It gets fixed with policy. Learn his name, Norman Clement. Read Legalized Extortion by Angela Green. Learn the names. Refuse to let this story be told only in the voice of a government press release. Stay curious. Stay informed.